Besides being an educator, I'm a singer. And when I sing a song, I'm not singing it just to myself. What happens to have, you got to feel what I'm singing. And the parents are saying, for you to be there to help me and my children, you have to feel what I'm saying. And for you to feel that, there has to be that understanding of a relationship and what comes out of it. Let's see, just the other day, I met with 3 of our consultants within the early relational health confines. And we just, actually, that was just yesterday. And we had such a great time. And we were debriefing and going over the different things that we discussed. And what happened is Miss Beth and Miss Kendra, they created some slides to depict what we talked about in a prior focus group that included some other parents that's not part of the consultant group, and some of the things that they had shared. And it was amazing. It was amazing because once they read a quote, maybe even I didn't remember, but when they saw something written that came out of their heart, came out of their mouth, that was oh, wow, that felt good. They heard me. They heard me. And that is the part that's important. They want to be heard, especially when you're talking about their children. You need to hear. And it'll, oh my God, it just takes time. And you see how precious it is, And it's not wasted. And then all these wonderful budgets that's on the table, the money is not wasted either. And so it's important that we include parent voice on this ride. Yeah, I'm gonna say on this ride. And this is what it is. It's a continual ride that goes on all the time. And the ride goes across all cultures. But we're talking here about families that are African American, Black, Indigenous, Brown, whatever you want to call it. Man, they want to be heard. They want to be heard. And for you to hear them, then you can treat properly. You can treat properly. Yes, it takes a lot of time. Yeah, it does. It's important for that. We have to take the time. In this meeting right now, we have taken efforts and taken the time away from our busy schedules to meet today and talk about this. So it takes time, not only with this, but actually to reach out on your own and make the changes. If this part about with the books, fantastic. I got a sidebar. Don't forget, include in that readers list, Renee Watson. She's one of our SCI kids. Some great books out there too. Wasn't that a great plug? But anyway, put her name on the list. But it's important. Oh my God, books are fantastic. Yes, I'm that kind of teacher. I get excited about everything. But in a book, oh my goodness, there's intimacy. There is sustaining and maintaining a relationship. There's responsibility. Oh my God, when you just turn the page or if you're scrolling, whatever you're doing, all of these things, it sustains a relationship. So if that child is doing that in their parent custodial caregiver's lap while waiting to meet with you, and it also sustains who they are as a person, as a culture, wow, when you guys get into that meeting between a patient and the doctor, it's going to be amazing. Nothing but healing is going to happen. So with the parents, these are the things that they're saying. It's just saying that, listen, please. They're saying, please listen. Have an ear to hear. Don't allow me to talk. Hear. That's what they're asking for you to do. And the predisposition, we all have predispositions. But what happens is, man, it can't be like this. You got to put it to the side. It's got to be put to the side. But guess what? I don't know how many people are in here. I think it says 39. That's 39 individual choices. 39 individual choices. You have to choose to put that to the side. And then those of you in your healthcare professions, if that's your office or not, you have to also reach out to the persons that's at the desk, the greeters in your office also. You might have this hip, hip, hooray situation and be the best provider in the world, But that person at the front desk, I mean, has that nice, nasty attitude, and it's just not okay. And so what happens is you have to reach out also to those persons that's your ushers. I call them ushers at the front desk and have that conversation like, how was your day? Share some of your interactions. Oh, no, these are some things you can look at. These are some things. So that takes time also. So with the parents, these are the things that they brought up. The ushers in your office, the relationships with the actual primary care providers, how that goes or how it does not go. Those things are important. This is all of these things prior to you actually giving a pill or a shot or whatever. And then the last thing that they spoke about is that there's a different type of environment from having state or government medical coverage compared to having coverage that is a benefit of your job. So they said there's a difference when it's through Oregon Health Plan compared to, like me at SEI, we have a health coverage. So they said that needs to be worked on. It shouldn't matter if it's afforded to them because they're on an income guideline compared to because that's part of their benefit package at their job. So that's what I have. Thank you.
Well, Ms. Marietta, that's incredibly helpful, valuable, meaningful, deeply heartfelt, and I'm so thankful. And there's so much we could talk about together. But let me shift back to you, Kate, to introduce our next presenter, I think.
Great. Thank you so much, David. I do have the pleasure of introducing Dr. Allison Empey. She's an assistant professor in the Department of Pediatrics at OHSU, Deputy Director of the Northwest Native American Center of Excellence, and Chair of the AAP Committee on Native American and Child Health. She's also a member of our Reach Out and Read Oregon Advisory Committee. And as a pediatrician and a member of the Confederated Tribes of Grand Ronde, she's going to share a bit about her work and experience with us today. Thank you so much for being here, Allison.
Thank you, Kate, and thanks to all of the other speakers today. I really loved hearing from each of you and took a little bit of something away, a little pearl as well. Like Kate said, my name is Allison Empey. I'm a citizen of the Confederated Tribes of Grand Ronde, which is one of the 9 federally recognized tribes here in Portland, or in Oregon, rather. And it's located in Grand Ronde, Oregon, which is about a 90-minute drive away from Portland. I have been fortunate enough in my career to be able to practice up at OHSU, but also have my tribe actually buy out some of my time so that I'm able to serve my community as well. There are not many pediatricians serving tribal communities, and I am actually the first pediatrician that they've ever had and the first tribal member to come back to the community. My work actually with my tribal clinic began during my residency, though when I discovered Reach Out and Read, it was something that we do at Dornbecker Children's Hospital, thanks in part to Dr. Ellen Stevenson, who's done so much work there. I became really interested in it and learned about all of the wonderful evidence behind it, and realized that that is not something that we had at my tribal clinic. So I grew up here in Oregon and received some of my health care at my tribe, and had a little bit of a relationship with them to know enough that they did not have Reach Out and Read. And I thought, if this isn't fair, I know that this works. Why don't the youth of my tribe have this access? And so became a trainer and actually took Reach Out and Read to our tribal clinic. And thanks to Reach Out and Read Oregon, we received support for that first year, but we trained all of the staff out there, and I'm proud to say that this program still continues today out there as well. One of the things that I noticed when we were starting Reach Out and Read and using some of the wonderful books that we get through our partnerships is that there weren't many books that featured Native American or other people of color either. And that's something actually I talked to my mentor about at that time. We were able to actually receive a private donor who was interested in this work, who actually gave us some money. So I went to Powell's Books. And there's actually, if you haven't been to Portland, Oregon and Powell's Books, there's a corner there that's devoted in the children's sections to Native Americans. And so we were able to find some books there, not to give out individually because they were a lot more expensive, but we were able to feature them in the clinic waiting rooms and also out in the lobby as well, so that children could see books that featured themselves, because I think that is so important. And in fact, there actually was a study that was done. It was the largest public opinion research for and about Native Americans through this nonprofit called Illuminative. And what it found is that really Americans, one, often don't think about American Indians, Alaska Natives post the 1800s. We learn about them in our history classes, but we learn about Columbus, we learn about the Trail of Tears, and we aren't often learning about what modern Native Americans look like today. And really, that is a form of racism, and visibility is a form of racism. And so I thought it was really important that we have books that feature people of color. And that's why we got those books. They have slowly disappeared, as you probably all know, if you have any in your reading rooms, but I thought that's okay, right? They went to homes where they needed to be. And so I loved what Martisha said about books earlier. I have a favorite book that I actually have, that I have at my home, that I read with my nephews when they come and spend the night over here, because I think it's so important that we have books. And she, I think, mentioned it being an Indigenous author, which it is. She mentioned that it shows color and healthy relationships. She also said it's important that we use words from our cultures, that it is modern, it's not just historical. And this book makes me so happy. It's so colorful. And when I heard her, I ran to grab it from my guest bedroom so that I could share it with you. And that's why I'm so excited to hear that Reach Out and Read Oregon is working to get these books out to the different sites that feature people of color. And so that's, I didn't really have much prepared today, but I just wanted to share my personal story. I often will use books during my Reach Out and Read when I hand it out in the beginning of the visits. I've recently made it a priority to try to use a book to get the conversation started about race, because we do have more books featuring people of color now in our clinic. And I find that's a really good opportunity to bring it up with families during that time. And so that is one way that I've been trying to use Reach Out and Read, and how I've been kind of doing some of that anticipatory guidance around talking with families about racism. All right, well, thank you so much for allowing me to speak today, and it's so wonderful to see so many faces.
Thank you so much, Allison. We have just gotten so lucky in how many great kind of take-home action items I feel like we've gotten from this talk. I was curious if anybody had any questions or comments, anything they wanted to ask any of the presenters specifically. If not, I can move on to a couple of questions that I have for everyone to hopefully spark a little bit of conversation.
15-second rule, Kate.
Well, I think Dr. Flynn, she's a family practitioner on this call today, and she has reached out in her program, and we were just site chatting, and I think Can you share your experiences, Jessie?
So I'm so privileged and honored to be here and really want to be mindful of time, but also thank you to Dr. Smith and Ms. Marietta for your hints and helpful solutions and things we can start to do and the conversations we can start and the intention behind it. And thank you, Allison, for your wise words of wisdom as well. I am a family medicine physician at OHSU. I've known Samira and Christina for a really long time. Also, my Reach Out and Read story starts when I was a medical student at the University of Michigan, and I volunteered at the neighborhood corner clinic in Ypsilanti, Michigan, with young women who were pregnant and having their first children, often under the age of 18. And my job was to sit in the waiting room and read their babies their books. And it was a really transformative experience. It is why I became a family medicine physician and why I continue to work as much as I can with this, with groups where literacy is not a given, and we need to promote health in all ways possible. And then I've been very fortunate to be in a place that supports Reach Out and Read, and we've been very fortunate to have Reach Out and Read books in our clinics and the training programs for our residents as well as our faculty. I'm really just very grateful for this experience. I've taken tons of notes, and I really appreciate everybody's helpful hints, and I'm going to take it back to my people and help make some improvements. Thank you so much.
Thank you so much, Dr. Flynn. That was excellent. I might go ahead and ask a question specifically, unless anyone has anything else they wanted to share. All right. Well, I'm curious, for those of you on this call who are providers, what if any barriers do you feel like you have in providing books that are diverse within your Reach Out and Read practice? I'll give it a second. I know that one of ours at Kaiser is definitely price. You know, we buy books based on price, and even though a lot of them tend to show diverse characters, what we've noticed is that they are not written by or put together, illustrated by people of color. It's almost exclusively white people, and you know, that is something I really would like to see change, and you know, something that I do think that there are people working with publishers out there on now through the National. If there is anybody from National here and they want to talk about that, I would love to hear it. Oh, there's some good stuff in the chat. There's a question, does Reach Out and Read have relevant posters for waiting rooms or suggestions of where to find them? And that's definitely something that we can work on as a team. I don't know if we can add that onto our action list, Christina and Samira. Maybe specifically, Nicole, I don't know if you're talking about with book lists or what specifically you were thinking there. Yeah. All right, awesome. I guess, you know, I also was curious if any of you want to share if you've successfully discussed racism in your pediatric practice and what was that like, and if you have any tips. I know Dr. MP shared some really great stuff with us, and you know, personally, I'm trying, you know, and I think it's been, every time I've asked about racism, it's been a wonderful conversation and actually deepening of my connection with the families that I see in clinic.
So with regard to my question, I know, because I used to be one of the people in charge of the Reach Out and Read program at the Vancouver clinic, that you guys encourage putting up posters in the waiting rooms that encourage reading and whatnot. And I think that you guys had some, you know, read with your kids, reading's fun kind of posters. And so that's why I was asking if there were any of that kind of nature, but that were more geared toward inclusivity and whatnot.
So we do have a variety of posters, and our program specialist is not on our call today. She's on vacation, but we'll definitely get in touch with you and show you the wide variety we have, and we can work with you on that.
I was so struck by Allison's word that in giving the book was an opportunity to open up the discussion about racism. As a way to begin that conversation, I also have been struck because then you're entering the space in trusted ways to then talk about strengthening relationships. So there's a pathway that may be discovered by this kind of opportunity.
And Jonathan from South River Community Health Center and FQHC that we work with is one of our newest partner clinics, which is amazing. Thanks for being here, Jonathan. Asked specifically, he's saying their clinic buys books. I'm guessing, Jonathan, in the chat box, if you can tell me probably All About Books or Scholastic. Those are two of our most popular resources. And so you buy specifically from those lists, and we are working with both of those distributors to ensure that our clinics know what diverse and inclusive titles there are. So absolutely, in the bundle that you will be receiving, your clinic as well, there's a letter and also a list of diverse and inclusive titles that will be coming your way. But I will also follow up with you just so you know how to access that list. But that is something that we have been working on with Scholastic and All About Books to make sure our clinics know that they're there and the titles are there. Does there need to be more? Absolutely. And that's something that we're working on as well. But I'll follow up with you as well, Jonathan.
And there's a great item in the chat from Martha Lilly, Multnomah County Library, about a poster of the 5 practices, and then there's a link in there. I'm hoping maybe we can get the group chat kind of put down and sent out with the PowerPoint so people can access some of these resources that are in the chat as well. That would be great.
We can do that.
Great. All right. Well, does anyone else have any other questions or anything they wanted to comment on today? All right. Well, thank you so much for joining us, everyone. I really appreciate it, and I hope we can continue this work together. Feel free to send any of us, the team from Reach Out and Read Oregon, emails, messages with ideas, and we'll try to continue sending out resources. Thank you so much.
Thank you. Thank you, guys. Thank you for joining.